Tonight, we are taking a closer look at mental health care in Alabama and the criminal justice system. Alabama ranks among the top of states with the least access to mental health care. I spoke with a Huntsville judge working to change that and a recent graduate of the city's mental health court.
Mickey Miller has epilepsy and says reoccurring seizures made it difficult for her to keep a job. That led to depression and anxiety, and Miller began to self-medicate by using illegal drugs.
I had gotten arrested for stealing some food, and I had gotten off with probation and a fine, but you know, the deadline's approaching and I don't have the money to pay the fine.
Miller's life was spiraling out of control. But instead of sending her to jail for not paying her fine, the judge referred Miller to Judge Sybil Cleveland's mental health court.
I came on the bench in 1999, and it was apparent then that there were growing numbers of people who were coming into the criminal justice system with mental health conditions, serious mental health conditions.
Judge Cleveland's court works in collaboration with mental health and substance treatment providers to help people who get caught up in the criminal justice system when the root of the problem can be traced to their lack of access to mental health treatment.
These people really didn't have the option of state inpatient facilities. And so a lot of the people that we see are people who traditionally may have been committed into mental institutions. And of course, some they have serious mental health conditions, but the resources just are scarce.
Judge Cleveland told me state mental health budget cuts led to an overflow of people who are in jail or prison who really need mental health treatment. An organization called the Sentencing Project ranked states based on the number of people in prison per 100,000 residents, comparing state-by-state rates of incarceration with the access to mental health care. The ranking shows a strong correlation between rates of adults who are in the criminal justice system and lack of access to mental health care. The states with less access to mental health care have more adults who are in prison. 6 out of 10 of the states with the least access to mental health care also have the highest rates of incarceration. These states include Alabama, Arkansas, Mississippi, Texas, Georgia, and Florida. Miller completed Judge Cleveland's program through the mental health court. After therapy appointments as part of the program, getting on the proper medication to treat her epilepsy, and passing drug testing, Miller graduated from the mental health court program and says her life is on a good track.
I'm staying busy, which is a good thing. I'm pretty much either at work or at church, and that's okay with me. It's good for me. And I'm doing really well. I'm happy, I'm healthy, and I'm really grateful to Judge Cleveland and the Downtown Rescue Mission for helping me get where I am today.
Upon Miller's successful completion of the mental health court program, her case was dismissed.
Judge Cleveland told me the program is also designed to save taxpayers money. It diverts inmates with serious mental health conditions from jail into community-based mental health programs. She says that reduces the overall inmate population. Currently, housing inmates in the Madison County Jail costs taxpayers $45 to $50 per day.